Traditionally, we've used overall survival and disease-free survival as the metrics that we evaluate drug therapies on. However, with newer agents that are coming on the market, there's a need to incorporate quality of life metrics. And the quality of life metrics that we should consider will be those psychosocial. We can also consider the cultural components, because these factors are critical in evaluating how patients will adhere to these drug therapies. And if we don't consider that, we may, yes, the drug may offer a 3-month or 4-month survival advantage, but what does that do to that patient at the end of the day? You know, if my patient is barely getting out of bed to come into clinic to get their drug, or even to continue their drug therapy, that's a major issue to consider. So these specific quality metrics are important. You know, looking at the psychosocial issues, looking at the cultural factors, the social factors, those are all important. Toxicity is a key factor. Recently I was looking at one of a breast cancer study, and the commentary or one of the aspects of the results from that study showed that, you know, scenarios where patients is on tamoxifen, for example, and the issue of hot flashes and the issue of vaginal dryness plays a very important role, you know, in neurosexual function. So, you know, yes, I am surviving my cancer, yet how does that interplay in my relationship with my spouse? And so those are some of the key factors. And we also know that there are some drugs that we may anticipate that maybe that's a combination, potentially can have an adverse impact on quality of life. Yet when studies have incorporated quality of life metrics, we've been surprised by some of the outcomes. Well, oncology is extremely complex. I think that if they had a way to just determine that these are the drugs we'll cover and this is what we're going to stick with, that would make life so much easier, but unfortunately it's not. I mean, I think about pancreatic cancer and I think about gemcitabine that was approved purely based on quality of life metrics. I mean, at that point, you have a supportive care, a drug that offers patient a better quality of life. That is huge in an area where we didn't really have a lot of options. So it is a little more challenging for the payer to say, you know, we are only going to look at quality of life. Yes, we have to take that in context with what happens with the overall survival and disease-free survival results.